Can we see the external view?
Yes, so if we go to the external view, I can show the port placement.
Turn the lights on.
He's switching now. 1 second.
Lights.
Okay.
Lights.
We're going to make some folks we have that.
It's up.
Okay, we see that.
So we have one 3mm Nathanson retractor. We have one 3mm left-hand port, one 3mm right-hand port in the patient's left upper quadrant. Then we have one 3mm port in the mid-clavicular line to the patient's left, and one 12mm port through the umbilicus. Those are the only ports that we will be using for this entire case.
Okay. Very good. We see that you were mobilizing the greater curvature, so go ahead and do that, and we'll come back to you. We're watching your operation.
Sounds good.
Thank you.
We're going to continue.
Okay. Can we try again with Dr. Lacey from Barcelona? Can we have the sound? Hello, Dr. Lacey. Dr. Lacey, we have no sound.
He's got the best resolution picture.
Yeah, we see a great image, Dr. Lacey, but we cannot hear you. I think probably if the sound is not solved at this time, would be best that you start operating, and hopefully the technicians can solve the case. And we have an internal view of your case. We see that you're between the legs, and you have an assistant on both sides. I'm going to comment on what I see because we have no sound. Okay, now we have the internal view, great internal view, and you're going to do a classic sleeve. Okay, so since everybody's operating now, I'm going to ask Dr. Fortner to take my place, and I'm going to go behind, solve these problems.
So, in order to maybe make it interactive for a second, I'm intrigued by what we're going to see in Spain, and I think in the agenda we titled this plastic sleeve. And I would imagine that there's some discrepancy amongst the panelists as to what constitutes a plastic sleeve. So maybe a little